Your fingernails are sending you a warning right now. And almost nobody over 60 is paying attention. 5 serious diseases hide in plain sight on your nails for months, sometimes years, before any other symptom appears. Diseases that, caught late, can steal your independence, your memory, even your life. And the most dangerous one, the one that shocked even me when I first saw it in my patients, is completely silent. No pain, no obvious signs, just a tiny change most people dismiss as normal aging. Stay with me until the end, because the number 5 sign on this list has been linked in recent research to a condition that affects 1 in 3 adults over 60 without them ever knowing it. 1 in 3. And yet your doctor has probably never once asked you to look at your nails. Before we go any further, if this sounds like something people you love need to hear, hit that like button right now, because this information could genuinely change someone's life. I'm Dr. Thomas Ashford, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've sat across from thousands of men and women over 60 in my clinic. I've held their hands while they processed difficult diagnoses, and time after time I've looked back at their photos from years earlier and seen the signs that were already there, written on their nails, ignored, dismissed, blamed on aging. That ends today. What I'm about to share goes against the passive, wait-and-see approach most people are taught to take with their bodies. I believe you deserve to know what your own body is telling you. I've seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. Now, before I get to the 5 signs, let me explain why your nails are so uniquely powerful as diagnostic tools. Because this is something the medical community has understood for decades and almost never communicates clearly to patients. Here's what's happening inside your body right now. Your nails are made primarily of a protein called keratin, and they grow continuously, averaging about 3 millimeters per month after 60. That sounds simple. But here's what makes them remarkable. Your nails are fed directly by the same blood vessels and nerve pathways that supply your organs. They share nutrient demands with your heart, your liver, your kidneys, your brain. When something goes wrong inside, when circulation falters, when a vital nutrient drops, when inflammation builds in tissues deep in your body, the nail matrix, the living tissue at the base of each nail where growth originates, responds. It changes the structure, the color, the texture, the shape of what it produces. It's like a slow printing press, laying down evidence of what's happening inside, millimeter by millimeter, week by week. A 2021 review published in the Journal of the American Academy of Dermatology identified over 40 systemic diseases that produce measurable nail changes before clinical symptoms appear. 40 diseases. And yet, when was the last time your physician spent more than 5 seconds glancing at your hands? After 60, this becomes even more critical. Your body produces significantly less of the proteins and enzymes needed for rapid repair. Circulation to the extremities slows. The immune system becomes less aggressive. All of this means that nail changes, when they appear, tend to persist longer and appear earlier in the disease process than in younger adults. Your nails, in a very real sense, become more talkative as you age. Here's what terrifies me most. The window between when a nail change appears and when a disease reaches a critical stage is often 6 months to 2 years. 2 years of warning that most people throw away. That window is a gift. Today, I'm going to make sure you know how to use it. Now let's look at the 5 hidden diseases your nails may be revealing right now, starting from the less commonly known and building to the one that I believe every single person over 60 needs to understand. Sign number 5. Pale or whitish nail beds and what they reveal about your kidneys. Look at your fingernail right now. Press gently on the center of the nail and release. The pink color should return within 2 seconds. Now look at the overall color of the bed beneath your nail, the skin you can see through the translucent nail plate. Is it a healthy, warm pink, or is it pale, whitish, almost the color of the nail itself? If your nail bed looks washed out, particularly if more than half the nail appears white with a narrow pink band at the tip, this pattern has a name. Doctors call it Terry's nails. And it is a recognized clinical marker for 3 serious conditions: chronic kidney disease, liver cirrhosis, and congestive heart failure. A study published in the Journal of Internal Medicine found that Terry's nails were present in approximately 82% of patients with liver cirrhosis and in a significant proportion of those with kidney failure, often appearing well before kidney function declined to levels detectable on standard blood panels. Here's what's happening inside the body. When the kidneys begin to lose function, they struggle to process a protein called albumin. Albumin is responsible for maintaining fluid pressure in your blood vessels. When albumin levels drop, fluid shifts. The tiny capillary networks beneath your nail beds, which normally give them that warm pink color, become compressed or reduced. The nail bed essentially loses its blood supply signal. What you see as pale or white is actually a reduction in microvascular perfusion, the fine circulation in your fingertips that mirrors what's happening in your deeper organs. After 60, chronic kidney disease is extraordinarily common. Research from the National Kidney Foundation estimates that over 37 million Americans have it, and the majority don't know. The early stages produce almost no symptoms, no pain, minimal fatigue that most people attribute to age, but the kidneys are quietly losing filtration capacity, and eventually, the consequences hit hard and fast. Before we move on, I want to take a quick pause. How old are you right now? If you're in your 60s, 70s, maybe even beyond, and you have never had your kidneys checked with a simple creatinine blood test, type kidneys in the comments below. Let me see how many of you we can get that information to today. Sign number 4, yellowing nails and the respiratory disease hiding behind them. Not the slight yellowing that comes from nail polish or smoking. I mean a deeper, thickened, slow-growing yellowing that affects the entire nail plate, sometimes with a slight greenish tinge at the edges. Nails that look almost opaque, nails that have lost their natural luster. This pattern is the hallmark of a condition called yellow nail syndrome. And while it can have cosmetic causes, when it appears in adults over 60 alongside any hint of breathlessness, swelling in the lower legs, or chronic cough, it should raise an immediate flag for underlying lymphatic dysfunction, chronic pulmonary conditions including bronchiectasis, or in some cases, early pleural effusion, a buildup of fluid around the lungs. A 2019 study in the journal Respiratory Medicine reported that in a cohort of patients eventually diagnosed with lymphedema or significant respiratory disease, nail changes had been present on average 19 months before their formal diagnosis. 19 months. Almost 2 years of warning. The mechanism here involves the lymphatic system, your body's secondary circulation network. When lymphatic flow becomes impaired, whether from chronic infection, inflammation, or structural disease in the chest, the fluid that normally drains from nail tissue backs up. Nail growth slows dramatically, sometimes to less than half the normal rate. The nail thickens. Keratin accumulates abnormally. Yellow pigment builds. The nail essentially becomes a record of chronic lymphatic stress. Here's something most people miss. Yellow nails combined with persistent morning cough that you've been attributing to post-nasal drip, or mild swelling in the ankles that you've been blaming on long hours of sitting, is a trio worth taking seriously. Those three together, even mildly expressed, warrant a chest X-ray and a pulmonary function test. Don't wait for breathlessness severe enough to wake you at night. At that point, the window for easy intervention may have already closed. Sign number 3. Horizontal ridges. What they tell you about your heart and blood pressure. Run your fingertip across the surface of your thumbnail. A healthy nail in a healthy adult should feel smooth or have only very faint vertical ridges running from cuticle to tip. Those faint vertical lines are normal aging. Nobody should worry about those. What you are looking for are horizontal lines. Deep grooves running across the nail from one side to the other. Sometimes one deep groove. Sometimes several parallel ridges stacked across the nail like growth rings in a tree. These horizontal grooves have a clinical name. Bowes lines, and they are caused by a temporary interruption of nail growth. Here's the critical point. Nail growth stops when the body undergoes significant physiological stress, serious illness, high fever, major surgery, chemotherapy, severe nutritional deficiency, or, and this is the one I want you to understand deeply, a cardiac event, a heart attack, severe hypertensive crisis, a period of extremely poor circulation. The nail essentially pauses production during the crisis and then resumes. The groove marks exactly when the event occurred, because nails grow at a known rate, roughly 3 millimeters per month. A groove 6 millimeters from the cuticle happened approximately 2 months ago. A groove at the midpoint of the nail happened about 4 to 5 months ago. I cannot tell you how many times I have examined a patient who came to me for what they described as unusual fatigue or shortness of breath, looked at their nails, seen Beau's lines, and said quietly, "Tell me about 2 months ago. Did something happen? Did you have a period of feeling very unwell that you wrote off as a bad cold?" And they think. And then they say yes. A 2020 study in the European Heart Journal reported that Beau's lines were identified retrospectively in a significant number of patients who had experienced undetected minor cardiac events, events that produced no chest pain and were dismissed as fatigue or indigestion. If you can feel a horizontal groove on your nails right now, I want you to take this seriously. Not with panic, with purposeful action. Schedule an EKG, get your blood pressure checked, ask your doctor specifically about your cardiovascular health. The groove is not a death sentence, it is a message, and the right response to a message is to read it and act. I remember Margaret, a 74-year-old retired school teacher from Atlanta. She came to my office because her daughter had practically dragged her in. Margaret had been tired for 3 months. She'd lost her usual energy for gardening, for her grandchildren, for her weekly bridge club. She kept saying it was just age, just winter, just everything catching up with her. When I looked at her hands, I saw 2 clear Beau's lines on both thumbnails and both index fingers. Symmetrical. Deep. I asked her about 6 weeks prior. She paused. She said she had spent a week feeling terrible, like the worst flu she'd ever had, but with no fever. Extreme fatigue. One night where she woke up short of breath but told herself it was just anxiety. We ran a full cardiac workup. The results revealed she had experienced 2 separate minor cardiac events. Her heart had been sending distress signals, and her nails had been recording them faithfully, while her conscious mind reasoned the symptoms away. Margaret started treatment immediately. Her cardiologist told her that catching it at that stage meant her long-term prognosis was genuinely excellent. She went back to her garden. She went back to her grandchildren. She told me at her 6-month follow-up, "Doctor, if you hadn't looked at my hands, I don't know what would have happened. I had no idea my nails were talking to me." This wasn't luck. This was the body finally getting listened to, and you can give your body that same respect. Before we continue, if you're finding this information valuable and you want to make sure you never miss what we share on this channel, I want to ask you 2 simple things. First, subscribe. My mission is to give adults over 60 clear, direct, actionable health information. Second, share this video. Think about someone in your life who has been dismissing symptoms, who has been saying, "I'm fine, it's just age." A single share could start a conversation that genuinely saves their life. Sign number 2, spoon-shaped nails and the iron deficiency that's stealing your energy and your brain. This one is subtle enough that most people live with it for years without recognizing it as a medical sign. Look at your thumbnail from the side. A normal nail curves gently downward, following the shape of your fingertip. Now look again. Is the center of your nail slightly flat, or does it actually curve upward at the edges, creating a subtle spoon or scoop shape where a drop of water placed on the nail surface would sit rather than roll off? This shape is called koilonychia, and it is one of the most reliable physical signs of iron deficiency anemia. Iron deficiency anemia is not just a young woman's condition. After 60, it becomes disturbingly common in both men and women. The causes shift. Reduced stomach acid with age impairs iron absorption. Chronic use of aspirin or NSAIDs causes microscopic gastrointestinal bleeding that slowly depletes iron stores. Dietary changes in retirement often reduce red meat intake. And most critically, iron deficiency anemia in older adults can mask underlying gastrointestinal pathology, including colorectal cancer, which bleeds slowly and silently into the gut, gradually emptying iron stores without ever producing dramatic symptoms. A landmark study published in The Lancet followed adults over 65 with new-onset iron deficiency anemia and found that approximately 1 in 10 had an underlying gastrointestinal malignancy detected within 2 years of their anemia diagnosis. 1 in 10. This is not a small number. This is a clinically significant signal. Here's the mechanism. Iron is essential for hemoglobin production, the protein inside red blood cells that carries oxygen. When iron stores fall, red blood cells become smaller and less capable of carrying oxygen efficiently. Your tissues, including the nail matrix, receive less oxygen. The nail matrix responds by producing nails that are structurally weaker and eventually change shape, losing the downward curvature and flattening or reversing into that characteristic spoon shape. Beyond the nail change, iron deficiency anemia produces a constellation of symptoms that most adults over 60 are experiencing and attributing to normal aging. Fatigue that is disproportionate to activity, difficulty climbing stairs, shortness of breath when speaking a long sentence, reduced ability to concentrate, pale inner lower eyelids, cold hands and feet even in warm temperatures, heart palpitations that seem to come from nowhere. Here's something most people miss. Iron deficiency affects brain function profoundly. Research published in Nutrients in 2022 demonstrated that adults with iron deficiency anemia scored significantly lower on tests of memory, executive function, and processing speed compared to age-matched controls with normal iron levels. Many patients I have treated for iron deficiency have described, after restoration of normal levels, feeling as though a mental fog they had lived with for years had finally lifted. They had attributed that fog to aging. It was not aging. It was a correctable, addressable deficiency. The simple blood test that reveals this is called a complete blood count with iron studies. It costs almost nothing. It takes 1 vial of blood, and it can tell you whether spoon-shaped nails, fatigue, and brain fog are your new normal, or whether they are a call to action that your body has been making patiently, month after month, while you waited. If you believe that what you've heard so far could genuinely help you or someone you love, type yes in the comments right now. If you're still skeptical, type 0. Your response helps other viewers feel less alone in what they're experiencing. I want to tell you about James, a 78-year-old retired engineer from Chicago. He came to me not for fatigue, which he had normalized completely, but because his wife had noticed that he had been repeating himself in conversation and struggling to find words. They were both frightened. They assumed the worst. They assumed Alzheimer's. When I examined James, his nails were unmistakably spoon-shaped on 4 fingers of his dominant hand. I ordered a complete blood count with iron studies and a basic metabolic panel before even referring for cognitive testing. His ferritin, the storage form of iron, was critically low. His hemoglobin was significantly below the normal range for men his age. His body had been starving for iron for what I estimated, based on the degree of nail changes, had been at least a year, possibly 2. We identified the cause. Chronic low-dose aspirin use combined with atrophic gastritis, a thinning of the stomach lining that had reduced his ability to absorb iron from food. We addressed both. We supplemented iron under careful medical supervision. We modified his medication regimen. 8 weeks later, James came back to my office. He sat down, looked me in the eye, and said, "Doctor, I feel like myself again. The fog is gone. I was convinced I had lost my mind. My wife cried when I told her." His repeat cognitive testing was entirely normal for his age. This wasn't a miracle. This was iron, a mineral, something that costs pennies per dose, that his body was simply not getting enough of, and that his nails had been communicating to anyone trained to read them. You don't have to accept cognitive decline as inevitable. You don't have to accept fatigue as the price of getting older. Your body wants to heal. It simply needs the right raw materials. And now we've arrived at the sign I told you about at the beginning. The one that affects 1 in 3 adults over 60 without them knowing. The one that is silent. The one most doctors never ask about. Sign number 1. Clubbing of the nails and the lung disease that could be developing right now without a single dramatic symptom. This one takes a moment to examine carefully, so I want to walk you through the exact assessment. Place your thumbnails together, nail to nail, facing each other, so the 2 thumbnails are pressed face to face in front of you. Look at the space between the 2 nails at the base, at the cuticle end. In a person with normal nails, you will see a small diamond-shaped gap of light between the 2 thumbnails where they meet. That gap is called the Shamroth window, and its presence is a reliable sign of healthy nail structure. Now here's what clubbing looks like. In clubbing, the angle between the nail and the skin at the base of the nail changes. The fingertip itself becomes bulbous, widened. The nail curves more sharply over the tip, like a parrot's beak. And when you perform the Shamroth window test, The diamond-shaped gap is absent or reduced to a sliver. The two thumbnails fit together with no visible gap. Nail clubbing is one of the most important physical signs in all of clinical medicine. It has been recognized as a marker of disease since Hippocrates described it in ancient Greece, and its presence, in an adult over 60, warrants immediate investigation. The conditions associated with clubbing span a serious spectrum: lung cancer, chronic obstructive pulmonary disease in advanced stages, pulmonary fibrosis, a scarring of the lung tissue, bronchiectasis, infective endocarditis, infection of the heart valves, inflammatory bowel disease, liver disease, congenital heart conditions. The underlying mechanism in virtually all of these is chronic hypoxia, meaning the tissues of the body are not receiving adequate oxygen, and the resulting cellular stress causes the soft tissue of the fingertips and the nail matrix to thicken and proliferate over time. Here is what makes clubbing particularly insidious in the context of lung disease. Early pulmonary fibrosis, early chronic obstructive pulmonary disease, and early lung cancer can all develop for years with minimal symptoms. A slight reduction in exercise tolerance that feels like normal aging. Occasional breathlessness on exertion that seems reasonable given your age. A mild chronic cough you've had so long you've stopped noticing it. These conditions are not announcing themselves loudly, they are whispering, and the nails are amplifying those whispers. A 2023 study published in Frontiers in Medicine found that in patients eventually diagnosed with pulmonary fibrosis, nail clubbing had been present and documentable on average 23 months before their formal diagnosis. 23 months. Almost 2 full years of physical evidence sitting at the end of their fingers that went unexamined. I want to talk about the statistic I mentioned at the opening: 1 in 3 adults over 60. That refers to the prevalence of undiagnosed chronic lung disease in this population, based on data from the Global Burden of Disease study. Chronic obstructive pulmonary disease alone affects an estimated 16 million diagnosed Americans, with an estimated equal number undiagnosed. Pulmonary fibrosis affects over 200,000 Americans and is frequently not caught until lung function has already declined significantly. Here's something most people miss about lung disease and aging. We naturally lose some respiratory reserve as we get older. Maximum breathing capacity decreases by roughly 1% per year after age 25. By the time you are 65, you have meaningfully less lung capacity than at 35. This means early disease hides more easily in the background of normal aging decline. You cannot feel the difference between losing capacity to age and losing capacity to disease, not until the loss becomes severe. But your nails can show the difference because they are responding to the oxygen content of your blood, not to your subjective sense of how you feel. Perform the Shamroth window test right now. Press your thumbnails together, nail to nail, and look for the diamond of light. If the gap is absent or markedly reduced, I am not telling you that you have lung cancer. I am telling you that your body is asking a question, and that question deserves an answer. The answer costs a single appointment: a pulse oximetry reading, a chest x-ray, a pulmonary function test. Basic, inexpensive, available tools that can draw a clear line between reassurance and early intervention. I remember Dorothy, a 69-year-old retired librarian from Minneapolis. She came to my office for what she described as routine annual care. She felt, in her words, perfectly fine. She walked, she gardened, she volunteered at the local school. The only thing she had noticed was that she needed to rest slightly more than she used to on her morning walks. She had attributed this entirely to being almost 70. When I examined her hands and performed the Shamroth window test, there was no diamond. Her fingers were subtly bulbous at the tips, the nails curved over in a gentle but unmistakable clubbing pattern. I also noted that her oxygen saturation on room air was 93% when she walked briskly in my hallway, a number that should not drop below 95 in a healthy adult at rest, let alone with mild exertion. I ordered a high-resolution CT scan of her chest. The results revealed early-stage pulmonary fibrosis, with bilateral ground glass opacities in both lower lobes. Dorothy's pulmonologist told her that they had caught this at a stage where anti-fibrotic medication could meaningfully slow progression and preserve her lung function for years. That catching it at this stage, rather than 2 years later when symptoms would have forced her to seek help, substantially changed her trajectory. She told me at her follow-up, "Doctor, I thought I came in for a routine checkup. I had no idea. I genuinely felt fine. How did you know to look?" "Because I looked at her hands. That's how I knew to look." This is what I want you to take from this entire conversation. Your body is not silent. It is communicating constantly through every structure it produces, through every surface you can see, including the 10 small windows at the ends of your fingers. Now let me give you a clear, practical action plan for what to do with what you've learned today. Start this week, not someday, this week, with a simple nail examination. Do it in good natural light. Do the Shamroth window test for clubbing. Look at your nail color for pallor or whitening. Feel for horizontal grooves across the nail surface. Look at the nail shape for any spooning or concavity. Look for thickening or yellowing of the nail plate, particularly on the toenails. If you find any of these signs, write down exactly what you see. Take a photograph with your phone. Bring both to your next physician appointment and ask specifically about the nail change you've observed. If your physician dismisses it without investigation, advocate for yourself. Ask directly whether the change could represent an underlying systemic condition and whether any investigation is warranted. You have the right to ask that question. You have the right to be taken seriously. If you see something that concerns you, do not wait for your annual appointment. Call the office this week. Describe what you found. Ask whether it warrants being seen sooner. Within a week of getting appropriate blood work or imaging ordered, you will likely have either reassurance or information. Both outcomes are valuable. Reassurance gives you peace of mind. Information gives you the ability to act when action has the most power to change outcomes. Within a month of catching and addressing any identified condition early, patients consistently describe feeling a quality of life improvement that they had not anticipated. Not just physical improvement, emotional improvement, the relief of knowing, the empowerment of not waiting passively for something to happen. Common mistakes people make with nail changes. Do not dismiss nail findings as purely cosmetic. Do not attribute every nail change to nail polish, household chemicals, or aging without considering systemic causes, particularly if you have also noticed any change in your energy, breathing, or cognition. Do not delay investigation because you feel mostly fine. The whole point of these signs is that they appear before you feel significantly unwell. Do not rely on a single brief visual glance. Use the Shamroth window test. Feel the nail surface. Look at the nail bed color after pressing and releasing. And do not examine only your fingernails. Toenail changes, particularly yellowing and thickening, can signal different but equally important conditions and deserve the same attention. So, what we've covered today are 5 nail signs that can reveal hidden disease in adults over 60. Pale or whitish nail beds as a marker for kidney disease, liver disease, or heart failure. Yellow, thickened nails as a signal for lymphatic dysfunction or chronic pulmonary disease. Horizontal grooves, Bowes lines, as evidence of past cardiac events or severe physiological stress. Spoon-shaped nails as a reliable sign of iron deficiency anemia, which can itself mask gastrointestinal disease. And clubbing, the absence of the Shamroth window gap, as a critical signal for chronic hypoxia and the lung conditions that produce it. Each of these signs has its own mechanism. Each points to a different system in your body. And each represents a window of time between early warning and serious consequence, a window that belongs to you. My main message today is not fear. It is not to live in anxiety about your fingernails. My message is the opposite of that. My message is empowerment. Now you know something that most people, including many adults with serious conditions developing quietly inside them, do not know. You have information. And information used correctly is one of the most powerful health tools that exists. Here is my challenge to you. This week, examine your nails in the way I've described, all 10 fingers. Take your time. If you find something that concerns you, act on it within 7 days. Make the appointment, take the photograph, show your doctor. Just that one action. That is all I am asking. One examination, one appointment if warranted. That's it. Because aging does not take away your body's ability to send you signals. Aging does not take away your ability to listen, and early detection does not require expensive technology or specialist access. Sometimes it requires nothing more than good light and a willingness to look at your own hands. If this video gave you something valuable, please do not keep it to yourself. Hit that like button. Subscribe to this channel so you never miss the practical, direct health information I share every week for adults over 60. And share this with someone in your life who needs to hear it. A parent, a friend, a sibling, someone who has been telling themselves they feel fine without actually checking. And now I want to hear from you. Which of these 5 signs will you look for first? Have you ever noticed a nail change and wondered what it meant? Share your experience in the comments. Tell me what you found. Tell me what your doctor said. Tell me if this changed how you think about your body. Because you are not broken. You are not simply getting old. Your body is communicating with you every single day. Today you learned one more way to hear what it's saying. Take care of yourself.